How often do you find yourself wondering if that delicious, high-fat food, the one that feels like a bit of an indulgence, can actually fit into a healthy diet, especially when you're maybe managing things like cholesterol or trying to maintain a healthy weight? It's a question so many of us ask. Well, today on the deep dive, we're taking a close look at just such a food, the macadamia nut, often seen as, well, a luxurious treat, right? But new research is revealing some truly surprising facts about its impact on our cardiometabolic health. We'll be unpacking a fascinating randomized clinical trial published in 2023 conducted by researchers at Loma University. And our mission in this deep dive is really to pull out the most important nuggets from this study, helping you understand what it truly means for your health, especially if you're navigating similar kinds of risks. Okay, so let's unpack this. Before we zoom in specifically on macadamias, what's the general scientific thinking about nuts and heart health? Because, their reputation has certainly changed over the years.
That's a great place to start. Nuts are now widely considered really a cornerstone of a heart-healthy diet. Major studies consistently link them to a reduced risk of cardiovascular disease, CVD, and overall mortality. What's truly compelling is that even just one serving of nuts a day, that's about 28 grams or an ounce, has been associated with something like a 29% reduction in coronary heart disease
Wow.
and a 21% reduction in overall CVD risk.
Those are pretty significant numbers. And I think the surprising part for many, given that nuts are quite dense in calories and fat, is that these health benefits often happen without an increase in body weight or BMI or body fat or waist size. It almost sounds, well, too good to be true sometimes. Is there a simple reason for that?
Yeah, you've hit on a really crucial point, and it's something we'll definitely dig into more with macadamia specifically. It's a surprisingly consistent finding across multiple studies.
Hmm.
Now, there is an important nuance here. While nuts are generally beneficial, some prior research suggests their cholesterol-lowering effects, and actually the effects of other dietary changes too, can be less pronounced in people who are already overweight or obese. Often, the biggest effects are seen in those who are, closer to a normal weight.
Right.
So understanding this general context is really essential for you, the listener, because it highlights why this specific macadamia study we're discussing today is so valuable, especially if you're managing your weight or other health risks.
Okay, here's where it gets really interesting then. What makes macadamia nuts specifically stand out from, say, almonds or walnuts? Because they do seem to have this unique, almost premium reputation.
They absolutely do. Macadamia nuts are quite unique and, maybe surprisingly, less studied compared to other common nuts. They're indigenous to Australia, and they have a really distinct nutritional profile. Get this, they contain the largest percentage of both total fat and monounsaturated fat, or MUFA, among all edible nuts.
The largest.
Yeah. About 75% of their energy comes from fat, and a staggering 82% of that fat is monounsaturated. They're also very low in polyunsaturated fat, though they do have about 12 to 18% saturated fat, which we'll come back to.
Okay, so an exceptional amount of that MUFA, the monounsaturated fat. Is there a particular type of MUFA that makes them special, or is it just the sheer amount?
Well, it seems to be both, actually. Their MUFA makeup is quite distinctive. Around 17 to 19% of it is something called palmitoleic acid. Most of the rest is oleic acid, which you might know is the main fat in olive oil.
Ah,
Now, palmitoleic acid is particularly interesting. It's being looked at as a potential lipokine that's like a beneficial fat-based hormone. This specific study didn't show a direct impact on blood lipids from it, but other data is suggesting it could potentially improve metabolic health, maybe reducing liver fat and insulin resistance. So fascinating potential there.
interesting.
And beyond the fats, macadamia nuts also contain other beneficial things like phytosterols, specifically beta-sitosterol. These are plant compounds known to compete with cholesterol for absorption in your gut.
So they might block some cholesterol absorption.
Exactly. The amounts in a typical serving aren't huge, maybe 30-something milligrams per ounce, but it all likely contributes to the overall picture. Okay, so let's dive into the specifics of this particular study then.
Yeah.
It was really carefully designed to get some real-world insights into macadamias, especially for people already dealing with some health risks. The researchers at Loma University, they wanted to see how these nuts impacted cardiometabolic health markers in what they called a free living environment.
Meaning not locked up in a lab, just people living their normal lives.
Precisely. The study involved 35 adults, aged 40 to 75, who were overweight or obese. And critically, all of them had abdominal obesity, carrying extra weight around the middle, plus at least one other cardiometabolic risk factor.
Like high cholesterol or blood pressure.
Exactly. Things like elevated total cholesterol, LDL-C, triglycerides, fasting glucose, or hypertension.
Huh.
So this makes the findings really relevant for potentially many people listening. They used a randomized crossover design. That's generally a strong approach in nutrition studies. Basically, participants ate their usual diet plus macadamia nuts enough to make up about 15% of their daily calories for 8 weeks. Then, after a 2-week break, a washout period to clear the effects,
Right.
they switched to just their usual diet without any nuts for another 8 weeks. That was the control period.
Okay, and the free living part means they just went about their business eating these nuts at home.
Exactly right, which gives us a much better idea of how this might work in the real world, not just under strict lab conditions.
And how much were they actually eating? You said 15% of calories, but what does that look like? Was it like a handful or more?
It varied a bit based on individual energy needs, but it ranged from 35 grams up to about 59 grams per day.
Mm.
So considering a typical single serving is about 28 grams or an ounce, they were eating roughly 1.2 to 2 servings daily. So a decent amount. And they were specifically asked to avoid other nuts and limit seeds during that macadamia phase to isolate the effects.
Makes sense. And did people actually stick to it? Compliance can be tricky.
That's always a key question.
Yeah.
But here, compliance was impressive, reportedly 94%. And they didn't just rely on food diaries. They objectively confirmed it using a blood test, a biomarker. They measured plasma, palmitoleic acid, remember that special fatty acid? And it significantly increased by 26% when people were eating the nuts.
Ah, clever. So we know they really were eating them consistently.
Exactly. It adds a lot of confidence to the findings.
All right, the big question then. The one on everyone's mind, especially when you're deliberately adding a high-fat food to your diet. Did eating all those macadamia nuts lead to weight gain? Did those extra calories translate to extra pounds for these participants?
Well, here's the headline finding, and it's pretty striking. Daily consumption of macadamia nuts did not lead to gains in weight or body fat. This was under those free living conditions in these overweight or obese adults.
No weight gain at all.
In fact, there was actually a small, though not statistically significant, weight reduction observed, about 350 grams, so less than a pound, but still downwards. They saw minimal differences in BMI, waist circumference, or overall percent body fat.
Huh.
Interestingly, there were small but statistically significant reductions seen in things like skeletal muscle mass, lean body mass, and total body water.
Less muscle. That sounds potentially concerning.
Well, the study authors suggest this might actually be due to shifts in body water rather than a true loss of muscle tissue itself. But it's something noted.
Okay. Still, that overall finding of no weight gain is fascinating and frankly probably a huge relief for many listeners. Despite adding, a noticeable amount of calories from the nuts, the study said about 97 extra kilocalories per day on average.
Yeah.
Participants didn't gain weight. So what are the potential reasons? How does that work? It almost defies the simple calories in, calories out idea.
It does seem counterintuitive, doesn't it? But there are several proposed mechanisms, and we see this pattern with other nuts too. One really interesting idea is the food matrix effect.
Food matrix?
Yeah, it's like the physical structure of the nut itself. It can actually trap some of the fat and calories, meaning your body doesn't fully absorb everything that's listed on the label. It's like the energy isn't fully bioavailable.
So the actual energy you get is less than predicted.
Exactly.
Yeah.
Studies on other nuts like cashews, almonds, walnuts, pistachios have shown their actual metabolizable energy.
Oh.
The energy your body extracts can be anywhere from 5% to even 34% lower than standard calculations suggest.
Wow, up to a third less in some cases.
Potentially, yeah. Another factor is that monounsaturated fats, which are obviously super abundant in macadamias, tend to have a higher oxidation rate. That means your body is more likely to burn them for energy rather than store them as fat, especially compared to saturated fats.
Okay.
And then finally, there's satiety. The high fat and fiber content of macadamia nuts might just help people feel fuller for longer.
Ah, so they might naturally eat a bit less of other things during the day.
Potentially, yeah. Similar effects have been seen with things like pine nut oil, which is also rich in certain fats. It helps regulate appetite.
Okay, so multiple potential reasons why the extra calories didn't lead to weight gain. That's fantastic news. But what about cholesterol? Did these nuts make a meaningful difference for these people who were already in cardiometabolic risk? What happened to their blood lipid levels?
So the study showed that eating the macadamia nuts led to reductions in total cholesterol, about 2.1% lower, or 4.3 milligrams per deciliter on average. And also LDL-C, the bad cholesterol, went down by about 4%, which was around 4.7 milligrams per deciliter.
Okay.
Now, importantly, these changes were not statistically significant within this specific study,
Ah.
and there were no significant changes seen in HDL-C. the good cholesterol,
Yeah.
or triglycerides, which is another type of fat in the blood, or in blood sugar control markers like glucose or insulin.
So the reductions were technically non-significant in this trial. Why is that still interesting or relevant for us, for the listener? Does it line up with what we see with other nuts?
That's a great question, and it really gets to the nuance here. What's fascinating is that the magnitude of these cholesterol reductions. So that 4-point drop in LDL, for example,
Yeah.
even though it wasn't significant here, likely due to sample size or variability, it's actually quite similar to the average reductions seen in much larger meta-analyses combining studies of other nuts.
Like almonds or walnuts.
Exactly. Those big reviews often show LDL-C reductions around, say, 4.8 to 5.8 milligrams per deciliter for almonds, walnuts, and other tree nuts. So the effect size here is right in that same ballpark. It's consistent.
Okay, so it fits the general pattern.
Right. But here's the real aha moment, I think, and the critical distinction in this study. This cholesterol lowering, modest as it was, happened without altering saturated fat intake.
Without changing saturated fat.
Correct. In fact, the average saturated fat intake was actually slightly higher, though again non-significantly, during the macadamia nut phase compared to the control phase.
That is crucial because often the argument is you need to swap out saturated fat for unsaturated fat.
Precisely. Many previous macadamia nut studies were controlled feeding studies where they purposefully designed the macadamia diet to be lower in saturated fat than the control diet. That makes it really hard to tell if the benefit came from the macadamias themselves or just from cutting back on saturated fat.
Right, it muddies the waters.
Exactly. But here, in this free living setting, the macadamia diet significantly increased MUFA intake by about 11.5% compared to the control diet, while SFA stayed roughly the same. So it strongly suggests the benefits, or at least these modest trends, can happen independent of just lowering saturated fat. The MUFAs seem key.
Okay, that makes a lot of sense. So if it wasn't just reducing saturated fat driving the change, what other mechanisms might be at work to help lower cholesterol from the macadamias?
Well, beyond just the type of fat, several other things are likely contributing. We already mentioned the phytosterols, like beta-sitosterol.
Right, competing for absorption.
Yes. And while the daily dose from the nuts here, maybe 40 to 70 milligrams, is less than the gram amounts you'd use for major lipid-lowering drugs or supplements, it could certainly have been a contributing factor. Every little bit helps, perhaps. Another likely mechanism involves the direct effects of the monounsaturated fatty acids themselves on how our body handles what we call cholesterol homeostasis.
How so?
Well, MUFAs might actually signal the body to produce less of its own cholesterol. And they might also improve the function of LDL receptors, particularly in the liver. These receptors are like docking stations that pull LDL cholesterol out of the bloodstream. Better function means lower LDL levels.
Okay, so multiple potential pathways there. Now, this brings up an important point you touched on earlier. Did everyone in the study benefit equally from these cholesterol-lowering effects, or did it depend on the person?
That's a really important question. The study observed what they called a non-significant trend towards greater lowering of total cholesterol and LDL-C among participants who had lower levels of adiposity.
Lower adiposity, meaning less body fat overall.
Essentially, yes. So, for example, those who were classified as overweight rather than obese, or those who had a lower percentage of body fat to begin with, tended to see slightly more pronounced effects, although, again, it wasn't statistically significant.
Interesting.
And this finding actually connects really well to the bigger picture from broader research. Other studies looking at various dietary interventions, including nuts, also often suggest that the lipid-lowering effects are more pronounced in people with lower BMI, less overall body fat, and less insulin resistance.
Why might that be? Why would having more body fat or maybe some insulin resistance make these interventions less effective?
It's complex. But one potential reason is that even mild insulin resistance, which is pretty common with abdominal obesity, can kind of disrupt the normal processes of making and clearing LDL cholesterol. The whole system might just not respond as efficiently to dietary changes aimed at lowering lipids when that underlying metabolic dysfunction is present.
Okay, that makes sense. It highlights that individual factors really matter.
Absolutely.
So let's try and recap the key takeaways then from this deep dive into macadamia nuts and this particular study. First, and this seems huge, even if you're carrying extra weight, maybe overweight or obese, you can likely incorporate macadamia nuts into your diet without causing weight gain.
Right. That's a major finding.
Second, they seem to show modest cholesterol-lowering effects, kind of in line with what we see with other nuts. But critically, in this real-world study, that effect happened without needing to cut back on saturated fat intake, suggesting the nuts themselves, particularly their MUFAs, are playing a direct role.
Exactly. That SFA independence is key here.
Third, their high monounsaturated fat content, and probably those phytosterols too, are likely the main players driving these benefits.
Mm,
And finally, it seems the impact on cholesterol might be a bit more noticeable for individuals who have lower overall body fat levels to begin with.
that trend seems to be there, yes.
Yeah.
Consistent with other research.
So for you, the listener, what does this mean practically? Well, it suggests macadamia nuts can be a really delicious, nutrient-dense addition to a heart-healthy eating pattern, especially if you're looking for options that, likely won't contribute to weight gain, which is a big concern for many.
Yeah, it makes them a viable option.
However, if your main goal is achieving significant reductions in cholesterol or other lipids, this study also reminds us that addressing overall adiposity, managing weight and body fat, probably remains a really important piece of the puzzle alongside dietary choices.
That's a fair summary. Diet is crucial, but it exists within that broader metabolic context.
Absolutely. So, as you consider all this information, maybe ask yourself this: how might knowing your own metabolic profile, your own levels of adiposity, or maybe insulin sensitivity, influence your personal approach to dietary changes for health? Could it encourage you to look beyond just general dietary advice and think about what might work best for your unique situation, something to mull over?